Hi Gabriel, today I'm going to be assessing your eyes, ears, nose, mouth, heart, and lungs, okay? In order for me to do that, I have to touch you. Is that all right? I'm going to be doing several different exams on you, and then we'll go through each step, and I'll instruct you what we're going to be doing, okay? All right, the first thing I'm going to be doing is assessing your eyes, beginning with your eyebrows and your eyelashes. Your eyebrows are thick, they are full, they are coarse, they are black in color, which is consistent with the hair on your head. They approximate in the center and they go to the outer canthus of the eye. Your eyelashes are thick and full, they are upward and outward bending. Your palpebral fissures are distinct and there's no sign of ptosis or lid lag. I'm going to go ahead and touch you now. And so your conjunctiva is pink and your sclera is white. Go ahead and close your eyes for me. I'm going to go ahead and palpate. All right, your lacrimal ducts and lacrimal sacs. Is that any tenderness there? Mm-hmm. All right, so no tenderness or no exudate noted on that. All right, Gabriel, I'm going to have you go ahead and look behind me. All right, at the picture there at Iron Man. All right, I'm going to look at your eyes here. Okay, now keep looking at the picture. Now focus your eye on my pen. Okay, so your pupils are equal, round. They react to light and to accommodation both bilaterally and concentrally. So now we're going to go move along to cranial nerve number 2, optic. And to do that, there's 3 exams, actually 4, but we're going to go ahead and start. The Snellen exam is for distance, and that's when you would stand 20 feet from the Snellen chart, hold your eye, cover your eye, and you would read from the top to the bottom, to the lowest line that you can read. That is for distance. Normal vision is 20/20, so basically that means the numerator 20 on the top, it means you're standing 20 feet away. The number on the bottom, for example, if you're 20/30, you're standing 20 feet away, and you can see at 20 feet what a normal person would see at 30 feet. That's the Snellen exam. The Romberg exam is for near vision, and that's when you would hold a card about 12 to 14 inches away from your face, and you would cover your eye, read from top to bottom to the lowest line you can read, do it again with the other eye, and then you would read from top to bottom, and then you would uncover both eyes and read, and if it was a perfect score, it would be 14 out of 14, and that's for near vision. Okay, another exam, another test that we do is the confrontation test for cranial nerve number 2, optic. So what you're going to do, we're going to check for your peripheral test, confrontation. All right, so I want you to hold this to this eye, please. I'm going to hold mine to mine. And this is the bunny, okay? You tell me when you see the bunny, all right? Just say now, and then we'll, okay? So when you see it, say now, okay?
No. No. No.
Okay, let's do the other eye. Ready?
No. No. No.
Okay, perfect. And that's the confrontation test. You can go ahead and relax your product. All right. Cranial nerve number 3, 4, and 6, which is ocular motor, trochlear, and abducens. We're going to go ahead and do something here with my... Alright. So I need you to go ahead and follow my pen for me. Okay, don't move your head, just move your eyes for me, okay? Okay, Gabriel. And now I'm going to go ahead and check your corneal light reflex. I'm going to go 12 inches in front of your eyes. Just keep both your eyes open. Very good. And the light reflected in both eyes symmetrically. You have the twinkle in your eye. I'm going to go ahead and now check your cornea on the side here for clarity. Keep looking at me. Okay, and this one. Alright, and the cornea is clear. The positions of your globes are symmetric, and there's no sign of exophthalmos. Now I'm going to go ahead and check your eyes. We're going back to cranial nerve number 2 optic with the ophthalmoscope. I would do this with the lights off. Alright, so you stand here. I'll put my hand on top of your head, okay? Keep looking straight, right? And note the red reflex. Okay, and the optic disc, the retinal background, and the fundus are noted. The fundus is a creamy yellow color. Let me go ahead and look at this by as well. Alright, the fundus is a creamy yellow color with a lot of arterioles and venules at a ratio of 3 to 5 or 2 to 3. There was no venous nicking or cupping. If you follow that nasally, you'll get to the optic disc, which is a round frisbee shape, 1.5 millimeters in diameter. If you move that over 2 discs temporally, you'll come to the macula densa, which is avascular. It's a cloudy gray color, and there you'll have the center of vision, the fovea centralis. And we'll have that on both, bilaterally on both eyes. Okay. So I'm going to go ahead now and move along to your ears. Okay, your ears are symmetric. They are in alignment with the outer canthus of your eye, the lower part of it, inferior to the lower outer canthus of your eye. The helix recoils appropriately. Any tenderness on the mastoid process? Okay, so now I'm going to go ahead and listen to your ears inside, or look at your ears inside. There we go. Okay. Up and back. Okay. There's some hair and cerumen in the extra auditory canal. The tympanic membrane, cone of light is at 5 o'clock. The tympanic membrane is a pearly gray color. You okay?
Mm-hmm.
Is that uncomfortable?
Sort of.
Alright, so let me check this ear. Same mouse cerumen in the extra auditory canal. Sorry. Okay. The umbo, the malleus, the pars flaccida, and the pars tensa are all noted. You okay?
Mm-hmm.
All right, so the tympanic membrane is a pearly gray, and the cone of light in the right ear was at 5 o'clock, and the left ear was at 7 o'clock. The umbo, the malleus, the pars flaccida and the above, and the pars tensa below were all noted. All landmarks or in appropriate places. Okay? Sorry about that.
Mhm.
Alright. One more thing we're gonna do is we're gonna do the whisper test, okay? And I'm gonna have you occlude one of your ears closed, and I'm gonna whisper in an opposite ear. So go ahead and hold one of your ears closed. I'm gonna whisper something.
Mhm.
Tell me what I said.
Batman, Iron Man, Superman.
Okay, let's do the other ear.
Mhm.
What did I say?
Baseball, basketball, tennis.
Very good. All right, and that's cranial nerve number 8, acoustic. Also a cranial nerve number 8, acoustic. We're gonna go ahead and I'm gonna do 2 exams, the Weber test, and I'm gonna go ahead and put this in the middle of your head. You're gonna tell me if you hear it in the right ear, the left ear, or both, okay?
Left.
You hear it in the left ear?
Mhm.
Okay. You wanna do it again?
Mhm.
Alright. Left ear or right ear or both?
Left.
Okay. Alright. So now I'm gonna go ahead and this is another test, the Rhine test. I'm gonna go ahead and hit it here, put it on the back here. You tell me when it stops, say now.
Now.
Do you hear it still?
Yes.
Tell me now when it's done. Okay, and air conduction is greater than bone conduction by a 2-to-1 ratio. And that was cranial nerve number 8, acoustic. All right, Gabriel, I'm going to move on to your nose. Actually, let me do this. I'm going to move on to your nose. Keep losing my pen light here. Okay, and for your nose, I see that your nose is symmetric. It's in midline. It's appropriate for your face. I notice you have a right papule on the right side. You have a papule on your nose. I'm going to go ahead. Actually, before I do that, is there any tenderness when I do that?
Mhm.
All right. Go ahead and look up for me, please. Okay. Let me just look. Actually, let me look and use this so the pen light can see better. Sorry. It's not going in your ear then. Alright, I'm going to go ahead and lift your nose up, alright? The nares are symmetric. Bilaterally, the septum is midline without any deviation. The mucosa inside is moist without any foreign bodies. The inferior turbinate is visible, but the superior turbinate is not visible. So Gabriel, right now we're going to go ahead and test cranial nerve number 1, olfactory. And I need you to hold one of your nose and breathe in. And do the other one. Breathe in. All right. So I'm gonna have you close your eyes, please, and I'm gonna give you a smell. Go ahead and tell me what you smell. Okay. You ready?
Mhm.
All right. All right. Well, go ahead and. Oh, that's right. What does that smell? Smell again. What does it smell like? You dropped it. What does it smell like?
Some kind of seasoning.
Okay, it's Bailey.
Bailey.
Okay, we're gonna go ahead, close your eyes, I'm gonna do one more smell for you, okay? Inhale. What does that smell?
Vanilla.
Yes, very good. Okay, go ahead and open your eyes. All right, we're gonna move on to your mouth now, okay? Your mouth, your lips are pink and they are moist. A little bit dry, but they're moist for the most part. I'm gonna go ahead and get my lips onto this. Okay, I'm gonna assess your mouth now. Okay, so your lips are moist and a little bit dry, but for the most part they're moist and they are pink. Smile for me. Let me see your teeth. All right, your teeth are nice and clean. I'm gonna go ahead and count your teeth, okay? Open your mouth for me. Stick out your tongue. Sorry. Okay, I'm gonna go ahead and count your teeth. Go for me real quick. Ready? Open your mouth, please. Okay, so you have 28 teeth and 2 fillings were noted. No sign of any extra dental caries. So open your mouth, please. Okay. Your gums are moist and they are pink without any ulcerations. Your mucosa is pink and without any ulcerations or lesions. I'm sorry, I know I keep saying Zena. Your superior frenulum is removed, but the inferior frenulum, lift up your tongue to the roof, and your sublingual frenulum are intact. Okay, Gabriel. Stick out your tongue and say all the way up and say ah. All right, the tonsils are at a +2 and the uvula was raised, it was midline, it was raised when you said ah. Open your mouth. All right, the posterior pharynx and under your tongue, please, and the sublingual area are well vasculated. You see? Okay, I'm gonna put my hands in your mouth now, okay? All right. Okay. All right, Wharton's ducts lower and Stetton's ducts superior are all palpable and they are noted. All right, Gabriel, stick out your tongue for me and go from side to side. Okay, and the other side. All right, the dorsal aspect is papillid. You see the lateral is nice and smooth. Okay, stick your tongue out again. Okay. That is cranial nerve number 12, hypoglossal. Go ahead, you can put it back in, sorry. Which is the movement of the tongue back and forth. Cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, the vagus nerve, has to do with your uvula, your uvula, your swallow, speech, and gag reflex. Open your mouth one more time. I just want to see the top of your mouth. I'm going to put it here. All right. The hard palate anteriorly. Open your mouth. Don't bite. And the posterior goes from hard to smooth. Okay. I'm sorry. You okay? All right. We're all done here. Okay. That takes care of those. So now, Gabriel, we're going to go ahead and move along now to your lungs. Okay? All right, Gabriel, to do your lungs, I'm going to have you take your shirt off, please. Alright, so I noticed that the chest is a light brown color, which is consistent with the rest of the body. There's hair distribution in the front of the chest. Just looking around. The hair distribution is gray with the black and gray color. You have a macula here on the right side of the chest. The diameter of the chest is half that of the transverse. So now I'm going to go ahead and palpate your lungs. Okay? Your lungs in the back. Okay. You tell me if there's any tenderness. All right. Would you be able to face the closet for me, please? Tell me if there's any tenderness. Okay. Any tenderness noted?
No.
Okay, so now I'm going to go ahead, move my materials here. I'm going to go ahead and pinch here. Alright, pinch a little bit. Again, breathe in. Breathe out. Alright, and the thoracic expansion was symmetric as you inhaled. Alright, Gabriel, now I'm going to have you say the word 99 when you feel my hands on your back here. Say the word 99, okay? Do you feel them?
Yes.
Alright, say 99 when you feel them.
99. 99. 99. 99.
Okay, and vibrations were noted with the ulnar aspect of my hands. Alright, Gabriel, I'm going to go ahead and percuss your posterior aspect of your lungs here, okay? Alright, now I'm going to go ahead and auscultate your back, okay? You're going to feel the stethoscope on your back. Just breathe in and out. And out just one. Okay, Gabriel. I'm going to do the same anteriorly, and then we're going to do one more thing, okay? So I'm going to go ahead and do this side. I have to come and do this side. Okay, Gabriel, breathe in. Sorry. Breathe in. Thank you very much. Now, oh, wait. Oh, I have to check your diaphragmatic excursion, which means I'm going to go ahead and measure how much your diaphragm has to travel when you breathe. Okay? Okay, we can come this side to check Gabriel. You gotta turn and face where you were. I'm gonna go ahead and measure. Okay, I'm gonna go ahead and do it on this side. Alright, I'm gonna percuss down here, okay? So what I'm gonna have you do, cross your arms and roll your back. I need you to breathe in and hold it, okay? So go ahead and breathe in and go, and you want you to roll down and hold it, okay? Are you holding? Okay, breathe out. It's not working. Oh my God, it's not working. Hold on. I'm sorry. My pen is not working. Oh, it is. Okay, there it goes. Alright, now I need you to breathe in and exhale. As you exhale, hold your exhale. Okay? So breathe in. Exhale. Exhale. Keep. Right. You can relax now. Go ahead and measure. Normal is 3 to 5, and this is at almost exactly at 5. Okay. Alright, Gabriel, now you can go ahead and turn this way. I'm going to go ahead and, you can keep your shirt off, because I'm going to go ahead and, we're going to do the heart now, the cardiac. This is the last portion of our exam, okay? Okay, so what we're going to do now is we're going to go ahead and I'm going to go ahead and do your heart now, okay? This will be, I'm going to also take your heart and we're going to get to that, okay? Alright, so first I'm going to go ahead and find, I notice actually with your chest that there's no lifts, heaves, or thrusts. I'm going to go ahead . Alright, and point of maximal impulse is the fifth intercostal space, midclavicular line. There are no murmurs noted and it's freely palpable. And I'm going to go ahead, and if you would like, you can go ahead and lie down. You can move back a little. You can move all the way back. Alright. I'm going to listen with the bell, with the diaphragm and the bell. Sternal notch. Okay. This is the aortic, which is second intercostal line, right sternal border. Pulmonic. Third intercostal space, left sternal border. Erb's point. Erb's point is third intercostal space, left sternal border. Pulmonic is second intercostal space, left sternal border. Okay. Tricuspid is fourth intercostal space, left sternal border. and mitral. Is midclavicular line, fifth intercostal space. Also known as apical pulse, point of fast index. Okay, S1 and S2 were noted. S1 is the atrial and mitral valves closing, and S2 was aortic over pulmonic. All right, I'm going to go ahead and auscultate your temporal arteries and your carotid arteries. Hold your breath for me. Okay, relax, you can breathe. Alright, so we have the temporal artery, carotid arteries, this is your brachial arteries right here, your radial arteries. We're deferring the femoral artery. Bend your knees up just a tad. Alright, just a little bit. Popliteal artery. Posterior tibials. Posterior tibials and dorsalis pedis. And with all the pulses, they are normal. There's no bounding or threading noted. Okay, thank you, Gabriel. Thank you for your time. Okay.